watching my video back, I just took a few notes and I wanted to add a few things to what I had said. So when doing an ear exam, if I had an otoscope, I would definitely use an otoscope to be able to visualize the horizontal ear canal and visualize the tympanic membrane, make sure that that is intact. If I had a ophthalmoscope, definitely would have done an indirect exam, indirect fundic exam, make sure that her retina looked normal, and then I'd be able to get a feel for the anterior and vitreous chamber as well, just to see if there's any particulates or fluid that appears, inflamed, or that she might have an infection in her eye. And my notes that I took. When looking at her face too, something that I did but didn't vocalize was look for facial symmetry. If she had a cranial nerve disease, maybe there'd be some muscular asymmetry in her face. Also, for that eye exam, you want to make sure that there isn't a blepharospasm, and that she's not squinting out of pain or discomfort. Might indicate doing a more advanced diagnostic like a fluorescein dye to see why she was painful. When I did the oral exam, I made sure that all of her teeth were there, that she wasn't missing any, and that none of them were chipped. When looking at her lymph nodes, I also would have wanted to palpate down the trachea just to make sure that I couldn't feel an enlarged thyroid or parathyroid gland or thymus, depending on how old the animal is. Hers is normal. There is not an abnormal swelling in her thyroid gland. I also, when I felt over her body investigating her body condition score, it's also a really good time to look for growths or masses on her chest or on her distal limbs as well. And Dina is normal. She does not have any masses, skin masses. When, along with that too, when I was looking at her stomach, it's a good time to investigate the mammary glands and make sure that they aren't swollen or showing signs of a growth. During her abdominal palpation, it's important too not to just focus on what I'm feeling in between my fingers, but to be looking at her and seeing if she's comfortable or not, because if she is painful, that could indicate a pathology. I definitely could have done a rectal exam on her. I don't think it was indicated because she does look pretty normal, but if I wanted to do a rectal exam, I would wear gloves, use lube, and insert my index finger and feel around for any rectal masses and check the anal glands as well and make sure that they're symmetrical and they're not swollen. When I was doing a distance exam and watching her walk around, I'm not just looking for lameness, I'm looking for ataxia or signs of like a proprioceptive defect or a neurologic disease. She was normal with that, and if it was necessary, I would do an advanced neurologic exam and check some of those proprioceptive defects by flipping her foot over and seeing if she'd flip it back on her own, checking her patellar reflex and checking her withdrawal reflex, things like that, just to make sure that there isn't any neurologic deficits or neurologic injury. I also could have done a more advanced orthopedic exam. I did talk about her history of luxating patella and torn ACL, or torn cruciate ligament, and I could compare how the angle of flexion that I'm able to achieve when flexing her joint. I know it would be less in the leg that she had surgery on, and I could take some measurements as to how different the size of muscle, the width of the muscle is over her femur on each side. But just because she is pretty uncomfortable with some of those things, and I've had them done by a professional doctor. Just for the purpose of this video, I didn't want to bug her, but those would be good things to know in a patient that actually that did have another orthopedic disease. Otherwise, I think that those are things that, although I knew that they were normal on her because I'm so used to looking at her, I just wanted to explain and kind of vocalize my thought process behind that in an additional video. So thanks for listening, and Dina and I hope you have a good day.